Hi guys, and welcome back to my YouTube channel. It's been a while, okay? So if you're here for the first time, hi, my name is Busari Mulyayo. I'm a registered nurse living and practicing in Nigeria, and on this channel I film content related to nursing and healthcare. In today's video, I am going to be explaining how to write a case study or a client case study for Nigerian nursing students. So if you've not subscribed to my channel, you're missing out. So please consider subscribing by clicking on the subscribe button below so you get access to more of my online nursing tutorials and my videos related to healthcare. Don't forget to like this video and share it to your friends when you're done. With that being said, let's get right into the topic for today. Now, one of the requirements of the Nursing and Midwifery Council of Nigeria to become a registered nurse, either in general nursing or in any nursing specialty, is that you have to conduct a client care study. And in a client care study, you're expected to take care of one patient from admission to discharge or death. So this is done to more or less give you an experience of caring for a patient, to certify that okay, this person has actually been in care of a patient and we can trust this person, we can license this person for general nursing or this particular specialty. I hope you get my point. Now, the issue with care studies is that some students do not know how to go about it or how to arrange it. Like they have an idea of what the care plan should contain, but they don't know how to put it together, and some students may not be lucky enough to get a particular guideline or a guideline that is actually very simple for them to follow for their client's care study or their case study. I hope you get what I'm trying to say. So in this video, I am going to be using a template, or should I say a guideline, that I feel is very simple to explain how you can write a nursing client care study. So this template is just going to be dividing your care study into 4 chapters. Chapter 1 will be the introduction. Chapter 2, sorry, I have running nose, so my voice might be sounding a little bit funny. So chapter 2, just like I said, will be the literature review. Chapter 3 will be where you do your patient care, and chapter 4 will be your conclusion. All right, so let's get into the chapters. So like I said earlier, chapter 1 is your introduction. So in chapter 1, what you're basically going to write is that, okay, let's take for example, you want to write a care study on a patient that has hypertension or a patient that has been diagnosed with hypertension. So in your introduction, you're going to be saying something like, this care plan is about Mr. A or Mr. B or Mr. C. Please remember, you're not supposed to put the names of your patients in your care study. You're supposed to use like initials or another name to represent the actual name of your patient, to uphold the ethical principle of confidentiality. So you can say this case study is about Mr. AI who was admitted to Federal Medical Center, let's say Ilorin or Lagos or Abuja or Port Harcourt. Do you get my point? With the diagnosis of hypertension. Then you just give like a brief introduction of what the case study is going to be about, and you can also include your patient's demographics, like the name, the age, the date of admission, sorry, initials, not name, the initials, date of admission, gender, height, or any other demographic data that you were supplied and does not contradict the ethical principle of confidentiality. So you can have that together as your introduction. Now chapter 2, moving to the literature review. What you can put in this chapter is information about the condition you're trying to talk about. For example, you can start with the anatomy of the affected organ. So because we are taking an example of a patient who has hypertension, now you might decide to write on the anatomy and physiology of the human heart. Then from there you move to write about hypertension, what it means, the blood pressure ranges, when the blood pressure is said to be hypertension, and the various classifications of hypertension. You can also discuss the pathophysiology of hypertension. You can talk about the epidemiology of hypertension. Take for example, if you're writing the case study in Abuja, you can decide to research for material on the prevalence or the incidence of hypertension among people in Abuja? Is it more common among the male or the females? Is it more common among the young or the old? You just put in some information about the affected organ or the affected part of the body and the method. So you talk about the signs and symptoms of hypertension, the complications of hypertension. Do you get? And you can include some things about the management. That will make up your literature review. Ensure that once you're putting together your literature review, you are going to be citing your sources. So if you're taking your information from a journal, let's say you're taking it from Busari and Busari 2023, you understand, you're going to be citing those authors, and you put together all the authors that you cited and make together a reference list. Now, I believe the latest referencing style that NMCN would approve would be the APA 7th edition. I'm going to try and see if I can get a document of APA 7th edition and link it down below, or whatever is the most recent APA referencing style, so that you guys can go through it and see how you're supposed to cite your authors and put together your reference list for your literature review. Okay, now moving to the chapter 3 of the care study, where you now talk about your care for the patient. So basically what you're supposed to put is everything that was done for that patient from admission till discharge or death. Do you get? So you talk about what was done during admission, how you took history, comments that the patient made. Probably the person is a non-hypertensive patient, or the person just is a newly diagnosed hypertensive patient, putting information like that. You proceed to talk about where the person was admitted. Was the person admitted on a simple hospital bed, in the open ward? Was it a VIP ward? Was it a private ward? Was it an isolation unit? To talk about where the patient was admitted. You now talk about the drugs that the patient was placed on. You know, every day the physicians, the doctors are going to come to see that patient. They will review the patient. So you talk about the drugs, how you administer the drugs, if the patient tolerated the drugs or the patient refused to take the drugs. You know, maybe there was non-compliance, or the patient had issues, or the patient wanted you to explain more. If you explain more, you document everything. You know, documentation is important in nursing, and most of these things will also be documented in the patient's folder. So you talk about the drugs the patient took every day. Maybe the person had to take some drugs in the morning, at night, if there were exercises for the patients, where the exercises were done, if there was inputs and output monitoring done. You just talk about all the nursing procedures that was done for that patient day to day, and the patient's feedback, how well the patient cooperated, and whatever information you feel is important. Day-to-day activities. This section is also supposed to consist your nursing care plan. Please and please do not write a client care study and not include your nursing care plan. Nursing care plan is, you know, the table where you have to put, sorry, if you don't know what nursing care plan is, I'm going to link some videos down in the description below that I filmed about nursing care plan, so you can get an idea of what a nursing care plan is. So your nursing care plan will have your nursing diagnosis, it's going to have your objectives, your intervention, scientific rationale, evaluation. Do you get my point? So that is basically what is going to make up your chapter 3 of the client's care. And at the end of chapter 3, you're supposed to indicate if the patient was discharged home. You know, after discharge, your probably the patient is discharged against medical advice, as DAMA, or if the patient was discharged as at the right time home on maybe oral medications to return for clinic, or you have to go back for follow-up care, you have to include that. And if reverse is the case and the patient died, you have to indicate possibly the cause of death, what happened, how you allowed the family to grieve, and all of that. Do you get? So you have to end it with either discharge or death of the patient. That's your client's care. And know for sure that you cannot predict what is going to end your client's care study. You might have expected that, oh, this is a basic condition and I don't think this should result in death, and at the end of the day you end up losing your patient. I'm sorry, that is what's going to be your client's care. So what is going to make up for the aspects of either where the patient died or other things that might have happened is going to be in your last chapter, which is chapter 4, where you put your conclusions and recommendations. Now, for someone that had a patient that died, your recommendation is something you should pay a lot of attention to, because you're expected to recommend ways to prevent a patient from dying from that kind of condition. I begin my point. So in your last chapter, you're supposed to conclude, recommend. Possibly you feel that there were some things that were done by the healthcare providers that they didn't do enough, or there were things that ways that we could improve how we care for people with hypertension, or ways to improve people's knowledge or awareness about hypertension, things that could be done. Possibly you're saying that people should go the nurses should go out for health outreach, community outreach, collaborate with NGOs to get free medications for people with hypertension, and so many other things like that. You put them in your recommendation and end it with your reference list. I hope you get my point. So let me take a recap of everything. I spoke about chapter 1, where you have your introduction. You give an overview of what the care plan, the client care study is about. Chapter 2, you talk about your literature review, which is going to contain some things, information, about the affected organ and the med-surg of the condition, as well as ensuring that you cite your authors properly, which will make up your reference list at the end of the document. Then chapter 3, I said you will talk about everything you did for the patient day to day, and also include your nursing care plan. And in chapter 4, you're going to be concluding and making your recommendations. That is a very, very, very simple template to write your case study. So if you enjoyed the video, you can click here and check out more of my nursing tutorials, and I'll see you in my next video. Bye.